Everybody ready to go? Okay. Well, good morning, everyone. Welcome back. The past few days have been most challenging for all of us. Just want to again say to Islanders thank you very much for your hard work and your adherence to the protocols. Also for answering the call for what has been a record number of Islanders to be tested in the last 4 days. In fact, since Saturday, we've tested over 11,000 Islanders across this province. And because of that number and what we have learned through the extensive testing, we have some comfort that we are ready to start to ease safely back by moving out of the 72-hour red that we found ourselves in on Sunday and back to a circuit breaker effective at midnight tonight. We will continue to monitor things closely, continue to test and trace, and as we work to wind our way through this most recent outbreak. So beginning at midnight and until 8 a.m. on March 14th, we will be in the circuit breaker, which we announced on Saturday. We will have some modifications to that circuit breaker, which Dr. Morrison will announce here in a moment. But these are decisions that we're comfortable in making because of the information we have gained through the testing and with the high number of tests, in particular in the specific industries and age groups that we had focused on. And as I say, Dr. Morrison will be explaining these modifications shortly. I will say that all schools on PEI will be open as of tomorrow morning for classes. I'd like to thank students, teachers, educational staff, and parents for their patience over these last few days as we have taken a 72-hour pause to learn more and to best determine the path forward for all of us. In addition to that, Three Oaks Senior High School, which was the site of a rapid test clinic over the last few days, is now undergoing a deep clean out of an abundance of caution, and it will be ready for students as well and staff to return tomorrow morning. This past year, and in particular these past few days, we have learned a lot, but in many regards, COVID remains a bit of a tangled mystery. It's an active virus that, as Dr. Morrison has continued to say, moves throughout this province when we move. So we need Islanders, and we ask Islanders and encourage Islanders to remain extremely vigilant and to continue to practice public health protocols, not just for your own safety, but for the safety of all Islanders. So with that, I will turn it over to Dr. Morrison for the most up-to-date information, as well as our new circuit breaker. So.
Thank you, Premier. Good afternoon, or I guess maybe good morning still. Today, there is one new case of COVID-19 to report. The case is a female in her 20s with mild symptoms. Given she was a close contact of a previously announced case, she has been in self-isolation. She has mild symptoms. One case has recovered, and there are currently 22 active cases. And I will note that this is the highest number of active cases in the province since the pandemic began a year ago. This time last week, we had one active travel-related case of COVID-19, and the number of cases rose quickly over for a number of days, resulting in the need to implement more stringent public health guidelines in the form of a circuit breaker measures last Saturday and then a 72-hour modified red alert phase on Sunday. The purpose of the 3-day modified red alert measures allowed us time to determine the extent of the evolving outbreak, conduct widespread and targeted testing, and to interrupt the chain of transmission of COVID-19. Until we knew more about the extent of the outbreak, it was important to take steps to limit movement and the interaction between people. As the Premier mentioned, over 11,000 people were tested between Saturday and the end of day yesterday. As of this morning, there are less than 800 tests pending. I asked yesterday about the modified red alert being an overreaction. We make the best decisions with the information available, balancing public health risk with the need to minimize societal disruption. As I've said before, there is no playbook for managing COVID-19, and we are learning more about this virus each day. Based on our own experience and that of our colleagues in Atlantic Canada, the importance of going fast and hard is the most effective approach. I would rather be here to explain why we acted to protect the health of islanders, as opposed to why we did not act fast enough or do enough. The past 3 days have allowed us time to determine the following. Although we have yet to identify the source of this outbreak, we believe there is a link between the cluster of cases in Summerside and Charlottetown. And all new cases detected over the weekend are linked to other cases in close contacts or to travel outside of the province. We are not seeing unlinked cases, and there is no evidence of widespread community transmission. The targeted testing for young people aged 14 to 29 in the Summerside area, and for those who work in certain areas such as food service, transportation and delivery, call centers, fish processing, meat packing, and anyone working in long-term care who is not vaccinated. To date, the results of this screening and testing are all negative, and this is very reassuring. Our system has responded well to the demand for testing and for contact tracing. I'd like to thank the many young people who responded so well to the call for testing, and to island families, businesses, and communities for doing your part over the past 3 days. Unfortunately, we are not yet totally out of the woods with this outbreak, and we may have more cases in the coming days. So we do need to remain vigilant and not let our guard down against this virus. This situation is a good reminder that as a province, we remain susceptible to the importation of COVID-19, both non-variant and variant strains. The red alert level phase with modifications, as the Premier mentioned, will cease at midnight tonight. And effective at midnight, we are moving back to the circuit breaker measures until 8 a.m. on March 14th. Each household can identify up to 6 consistent individuals they gather with, indoors or outdoors. These individuals may include family and friends. They must be consistent, and physical distancing should be maintained. Outdoor gatherings are safer than indoor gatherings. Personal gatherings should be kept as small as possible and no more than your household plus 6. Organized gathering limits of 50 for activities including concerts, worship services, and movie theaters. No additional cohorts are permitted. Weddings and funerals will continue to be up to 50 people plus officiants. No wedding or funeral receptions are permitted. Supervised gyms and fitness facilities can operate at up to 50% of standard operating capacity with additional cleaning. Museums and libraries can operate at 50% capacity. Rehearsals and individual and team practices are permitted in accordance with gathering limits. Games, tournaments, and competitions are not permitted. Retail stores, markets, and crafts fairs can operate at 50% of standard operating capacity, provided entrances and exits are monitored to ensure that capacity is not exceeded. In-room dining is permitted in accordance with the gathering limit of 50 people, with a maximum table size of 6 individuals and a 10 p.m. closing time. Takeout and delivery are also permitted. Personal services may operate on an appointment basis, provided a non-medical mask is worn at all times by staff and patrons. Child care centers may continue to operate at full capacity, and even though some of my children are not as excited, full-time classroom learning K-12 can resume with public health measures in place. And in long-term care, there will continue to be 3 partners in care and designated visitors. There is one additional public exposure notification today to announce, and I also will mention one that came out with the press release yesterday but was after the conference. And anyone at these locations at the specified times should be tested and self-isolate until they receive negative results. The public exposures are as follows: Scotiabank at 274 Water Street in Summerside on February 17th and 25th between 2:30 and 4 p.m., and February 18th, 22nd, and 24th between 1:30 and 3 p.m. And it came out later yesterday, the Bombay Cuisine at 339 University Avenue in Charlottetown on Saturday, February 20th between 6 and 7 p.m. These notifications will be posted on the provincial website. The current outbreak is a reminder of how quickly COVID can spread. And by the time we know there are cases, we sometimes will have an outbreak. It's a reminder why we need to be careful and practice these public health measures. It's a reminder to all of us, including me, our team, whether we're at the border or the business, that this can happen. And this is hard on each and every one of us. And this, because this pandemic has affected every single person. So thank you to all Islanders for your steadfast support. We appreciate that moving between phases and different measures is challenging. Like everyone else, I'm looking forward to the end of this pandemic and getting back to our normal way of life in our beautiful province. I'd say it's even more than looking forward to it. I can hardly wait, and I know the Premier feels the same. Thank you for your patience as we cautiously and carefully maneuver our way through this pandemic, always focusing on protecting the health of Islanders. Although we are all weary and tired of COVID-19, I urge all Islanders to maintain your guard against COVID-19. So let us proceed cautiously and let us continue to be patient and kind. Thank you.
Well, thank you very much, Dr. Morrison, and great news and great words as always. And I can't wait till I meet you in the basement of the Shaw Building and we can say, remember that old COVID thing? That'll be one of the happiest days in my premiership for sure. So with that, I will turn things over to some questions from our friends in the media.
Gabrielle Truman, Radio-Canada.
Good afternoon to you both. Bonjour, Dr. Morrison. Donc, aujourd'hui, vous avez annoncé que vous mettez fin à la zone rouge ici à Lille. La Provence sort de cette zone rouge-là. Alors, j'aimerais que vous m'expliquiez en français quels sont les facteurs qui ont contribué dans votre décision annoncée aujourd'hui.
Bonjour. Alors, c'est plusieurs facteurs vraiment ont contribué à la décision. On a les cas qu'on a eus depuis plusieurs jours, ils sont tous liés et on a fait tellement de tests. On a vraiment, j'ai pas dit ça en anglais, mais 7% de notre population a été testée dans 4 jours. C'est vraiment incroyable. Et puis, on n'a pas vu les cas qui sont pas liés aux autres. Alors, ces choses ensemble nous donnent un peu de confort, qu'on a un peu plus de rassurance vraiment quand on n'a pas grand nombre de cas qui ne sont pas liés et j'espère, alors on entre encore dans les circuit breaker, les mesures de circuit breaker, mais c'est on fait ça avec attention, mais on fait ça avec plus d'informations qu'on avait il y a dimanche.
Parfait. Et vous nous annoncez aujourd'hui une très bonne nouvelle et aussi vous l'avez annoncé aussi une autre bonne nouvelle hier concernant le fait que la plupart de la population de l'île sera vaccinée d'ici le 1er juillet. Alors, Dr. Morrison, ma question c'est à quoi la prochaine saison estivale va se ressembler ici à l'île? À quoi on doit s'attendre? Est-ce qu'on va pouvoir voyager, organiser des événements? Comment les gens vont pouvoir s'organiser pour la prochaine saison estivale?
C'est la bonne question et puis je sais que tout le monde veut une réponse. Et puis j'ai mentionné hier, mais c'était peut-être en anglais, que c'est vraiment, j'imagine qu'on va avoir plus d'informations et plus de décisions en avril, parce que c'est les questions comme ça qu'on est en train de discuter, regarder l'information qu'on a et de faire les décisions qui peuvent aider les gens à faire les plans. Mais je sais qu'on a les mêmes discussions avec le Premier ministre, mais on n'a pas tout décidé encore. Mais j'espère que ça va à l'air mieux que l'été que l'année passée.
Ok, parfait. Merci beaucoup.
Ok.
Bonne journée.
Bonne journée.
Laurent Rigaud, La Voix.
Yeah, good afternoon to you both. Dr Morrison, j'ai une question au sujet du nouveau cas qui a été annoncé. Vous avez dit qu'il est lié aux autres. Est-ce qu'il est lié plutôt à la grappe de Summerside ou à la grappe de Charlottetown?
C'était un cas qui était un contact des cas plutôt à Summerside.
D'accord, merci. Et donc, il y a eu d'abord ces 3 cas à Summerside la semaine dernière, puis une personne à Charlottetown, et ensuite ça a augmenté. Est-ce que tous les nouveaux cas qu'il y a eu, qui sont liés, est-ce que c'était des contacts proches des premières personnes malades, ou est-ce qu'il y a eu des contaminations secondaires, par exemple, entre un contact proche des premiers cas et ensuite avec un contact proche de ce contact proche?
Il y avait, on parlait depuis quelques jours, on avait deux clusters, des cas à Charlottetown et à Summerside. Alors, ils sont pas. Je pense que vous parlez si on a des transmissions de vraiment, comme on dit en anglais, les first generation, second generation spread. Et puis, c'était plutôt les contacts, mais ils sont pas tous reliés aux 3 premiers cas. Et ça dépend vraiment. C'est pas les cas en premier que des fois sont les premiers cas qui commencent. Et puis on connaît vraiment les dates des symptômes et tout ça. On discute ça avec l'équipe, mais c'est vraiment ça n'a pas l'air à ce moment aller plus loin que les contacts de quelqu'un d'autre, mais ils sont pas, il n'y a pas un cas index, si ça c'est qu'est-ce que vous demandez.
Oui, c'est pas aller au-delà de la 2e génération, c'est ça?
Exactement. I realized that I think it was in one of the questions to the testing. I missed, and I answered part of it in French. I missed one of the points that we have actually tested 7% of our total population in the last 4 days, and maybe you had mentioned it too, Premier, but that's a huge amount, and really a large portion to be done. So thank you to the individuals who took the time to be tested and in some cases waited very patiently for your turn. And thank you to the hundreds of staff who worked long hours to support this testing strategy. And thank you to the many healthcare workers who worked long days over the weekend. And a special thanks to the families of those healthcare workers who also made sacrifices allowing their loved ones to be at work. And I missed that very important point earlier. So thank you because of one of the questions. I noticed it.
Steve Bruce, CBC.
Yes, hello to you both. I know you were asked a question in French there about where things stand on the decision to lift travel restrictions. Can you just speak to that quickly in English, and maybe if the Premier wants to weigh in on that as well?
Okay. Hi. So I think I referenced it a little bit yesterday and in the notes that as we learn that we may be able to vaccinate more islanders and in a shorter period of time, which is really great news. And as we sit here with the highest number of cases that we've had at any point in the pandemic, it's really important that we focus on getting people vaccinated as quickly as we can. But with that information come more decisions around and policies around travel and what that looks like even within the region and also across Canada. I know the Premier has also raised those same questions, and we are in the process of discussing that with our team, and I know the Premier has too. We want to keep everyone safe, but we want to make sure we get people vaccinated, and we also are learning more and more every month about the vaccine and even its role in terms of asymptomatic transmission. And we've referenced that before, and I actually think we'll know more even in the next couple of months, and that will contribute to our decisions and our recommendations about travel, both out of PEI and those coming in.
Yeah, and the only thing that I could add to that, I guess, Steve, would be that, in what has become almost a daily meeting or briefing that Dr. Morrison and I have, it really takes on two different tones. One is we deal with the most up-to-date information that we get from overnight testing, and we have a conversation about sort of where we're at in this particular moment as it pertains to COVID. And we also allow the conversation to deviate toward the next steps and what we need to do. So whether that's, lately it's been a lot of talk about vaccinations and how we roll that out, but it's also about how we sort of transition back into that kind of normal that we're all really longing for. So, I mean, those are the more exciting parts of our conversation, to be quite honest. But, I mean, obviously we want to be open as soon as we possibly can when it is safe to do so. And that's the fine line that we're trying to walk along this. I think every other Atlantic premier is in the same position that I am here as PEI. It's not normal to be closed off to the extent that we are, and we want to do that as quickly as possible. We know we have an economy that relies on the transportation of people in and out of our province, and so all of those things that we talk about, and we feel we're close and closer than we've ever been to getting there, but we're just not there yet, and a little bit hesitant to throw an exact date out there because COVID is so, as I say, it's a tangled mystery that just keeps biting us from a number of different angles.
Thanks so much. And you mentioned that you are still waiting on 800 test results to come back. I'm guessing there's other people that didn't get tested yesterday because of the weather, and then you're still waiting to see if any more of the positive cases are variants. So why make this decision right now on Wednesday morning to move out of the red zone? Why not wait a little longer until you have more of that information?
Well, we went into the circuit breaker on Saturday with these measures because we were concerned, and we were really trying to, because we already had started getting cases, and I think the 72 hours was one additional measure, but we are still going to proceed with the circuit breaker measures for the next 10 days. We are always balancing that the goal of trying to minimize illness and hospitalizations related to COVID, but we're with the other goal in this pandemic is to minimize societal disruption. So how do you balance those two goals as we go forward, knowing that we really, if we can do as much as we can to protect people in the next few months and get them vaccinated, we're all going to be in a better place. So I think it's not to say we're not going to get another case, but we also know that we've done a huge amount of testing, and with the results back on over 10,000 cases or 10,000 tests, and we're not seeing these unlinked cases in the community.
And that's been the comfort level for me as well, Steve. I mean, it's a question that I think over the last 72 hours we've asked each other quite often, what is this information telling us? And the information is essentially it's a broad scope, 11,000 tests, but from all across PEI as well. I mean, we've had clinics in Montague, O'Leary, Stratford, Charlottetown, Three Oaks, Lemon Park. So this is a fairly substantial sample, and the fact that we don't have unlinked cases is a good thing. But as we've been doing for a full year, we evaluate this every day. If something comes up later today or tomorrow that we have to pivot, I think we've demonstrated that we will do that. We will do it quickly, and we will do it with confidence based on the information. And that's just how we will need to continue to do this until we're through it.
Thanks. And my second question, I'm guessing the decision to go back to in-room dining might raise some eyebrows. So can you explain how you arrived at that decision? Why now is the time to go back to that?
Well, again, it speaks to what we did not know on Sunday, and or what we've learned more about in terms of some of the initial information on the weekend was around the link to at least one restaurant, if not more. There was the age group that was initially, or that has continued to be impacted. And when we made the decision on the weekend, we didn't know the extent to what that might have impacted other restaurants, other people who might have been working in that industry. So, and that's also why there was that targeted testing as well. So we know more and now than we did on the weekend, as I mentioned, and so that gives us a different ability to open in-room dining, but with restrictions, of course, limited to 50 and also smaller table sizes and a closing time that's earlier than I know. And I know that's challenging for restaurants, but I think if we can do this for the next 10 days, I think that will even give us more information.
Okay, thanks to you both.
Thanks.
Louise Martin, CBC.
Hi, good afternoon to both of you. You mentioned, Dr. Morrison, the importance of getting everyone vaccinated, and so there's been quite a few questions regarding yesterday's decision to delay the second dose, and I know that PEI is making this move ahead of NACI's recommendation. How do you respond to islanders who do have concerns about waiting for that second dose, since this is a vaccine we've never used before? It's not like other vaccines.
Well, I guess anyone who's having it's really just, it's not even a delay, it's just an extension of the interval between the first and second doses. And so anyone who's already had appointments booked for their second dose are still going to get their second dose as they're booked. And there is emerging evidence out of this country and elsewhere that shows that there is not only good effectiveness a couple weeks after you get your first dose, but that persists. And Quebec has been doing that for the number of months. We know BC has announced it. New Brunswick has previously announced it for certain age groups. So this is not, and that's based on data that is coming out. And I would anticipate that the National Advisory Committee on Immunization, Public Health Agency will also be doing a very similar kind of announcement. So I think it's only something I think people can be, after all this time, know that we are making decisions to help protect islanders. And we know we want to protect islanders, as many of us, as fast as we can. And we would only be making that recommendation if we thought it was good for everybody. And I think this is a very good decision for this province and the other provinces who are also doing it. And I imagine even more provinces will be extending that interval between the first and second dose.
We learned we're getting the AstraZeneca vaccine. I believe it's already arrived in Canada. Do you have details that you can share on when PEI will be getting its doses of that particular vaccine and how many?
So yes, the country is, as you mentioned, the vaccine was approved last Friday, and I mentioned yesterday PEI is going to be getting AstraZeneca vaccine. The final number of AstraZeneca to us has not been confirmed, but we would anticipate it arriving in the province in the next within the week, perhaps the first shipment. It will be a smallish number relative to our other vaccines, but every vaccine is good for us, and we will use it.
Thank you.
You're welcome.
Natasha Pace, CTV.
Thank you. Dr. Morrison, just along the same lines with the AstraZeneca vaccine, I know Nova Scotia isn't quite sure whether or not they're going to accept it now, but you said PEI will be accepting and will be using it. Can you elaborate on what groups will be getting that particular vaccine?
Yes, hi. So as you know, it has not been approved for use in an older population. It has been only approved for adults, younger adults, 18 to 64. And certainly our initial conversations have been focused on younger, healthy adults who are really frontline essential workers in certain categories, and to start with, and then as we get more AstraZeneca, then we'll certainly be having that conversation to expand that out as well.
Okay. And you said you don't know exactly how many doses you're getting of AstraZeneca, but have you already informed the federal government that you will be accepting that vaccine?
Our indication is yes, that we would be willing to accept ours, and it is on a per capita. So certainly, although we haven't confirmed any, I don't have any confirmation of the exact numbers. When we look at how much is coming into the country, this initial shipment might give PEI a couple of thousand doses.
And I did a conversation yesterday with the Prime Minister. We talked about a number of different things. This was one of them. I confirmed to him that PEI wants to get as many people vaccinated as fast as we possibly can to get through this, and that we would gladly be accepting the AstraZeneca vaccine and put it into the rotation through public health.
Dave Stewart, The Guardian.
Good morning, and thanks as always for taking the time in what has been an intense past week. Just a question to follow up. I think Dr. Morrison, yesterday you had mentioned everybody is going to get a chance to get their first shot by July 1st. Do you have sort of a percentage, a goal in mind as to how many Islanders you'd like to have vaccinated to make that different summer possible?
Hi. So yes, we've said right along that we'd really like to get 80% of our adult population vaccinated, and that number is just over 100,000, and of our, if you work out our adult population here, so we know we'll have enough vaccine. We already have done so many adults, of course, before the end of March, and then we'll be able to then add on with additional vaccine in much greater numbers, be able to then offer first doses from April till June, and then people will also start then getting their second doses in the summer.
And just building on that different summer, I think you said yesterday that, we're certainly hoping that it'll be better than 2020, perhaps not back to the good old days of 2019. I'm assuming the Atlantic bubble is what we're shooting for, but can you expand at all on what this different summer might entail? Is it festivals and events? Is it Old Home Week? Anything?
I think, Dave, that's a very similar question, I think, to the one I took in French, and really we don't have a lot of those questions all answered yet, but we will, and but we all are looking in terms of what does a different summer mean. It will be in terms of hopefully a different level of activity and a different level of movement and travel, and I think some of what exactly that will look like will be clear over the weeks ahead. I don't know if you want to.
Yeah, I don't, other than I think we all hope that it's vastly different than it was last year, but we know there are limitations caused by COVID and the repercussions that COVID will have going forward. As I outlined in my State of the Province and again in the speech from the throne last week, that we envision this spring that the Atlantic bubble will be open, which should hopefully be a couple of months prior to when it was open last year, which should be good news for PEI. And then as the vaccination programs roll out across the country, we will need to work to figure out how we have the interprovincial travel through Canada and what that will look like. And there are a lot of questions around that. So as we do vaccination rollout, as we continue to deal with COVID and look toward the future, these are among the many, many things that we are trying to figure out. But I mean, certainly hope we can have All Home Week and, the Charlottetown Festival and all of these things. Even if they have to be somewhat abbreviated for this year, I hope we can have them because last year they were sorely missed.
Yeah. Terrific. Thank you both so much.
Thank you.
Julien Lecacher, Radio-Canada.
Bonjour, Dr. Morrison. Good afternoon to you both. Dr. Morrison, vous avez parlé déjà depuis hier de cette vaccination. Vous espérez recevoir 100 000 doses et donc vacciner 80% de la population insulaire d'ici la fin du mois de juin. Dr. Morrison, comment ça va fonctionner? Est-ce que la province va appeler les insulaires? Est-ce que vous allez procéder par ordre? D'abord les personnes de 60, 50 ans et on finira par les plus jeunes. Et ensuite, est-ce que ce vaccin, cette vaccination, cette première dose sera obligatoire?
Bonjour Julien. Je vais commencer avec la dernière question. C'est pas obligatoire, non. Et puis, je m'excuse parce que j'ai pas fait peut-être en français hier, mais je sais qu'on est en train de mettre sur le site web vraiment comment on va en faire avec les groupes. Alors, on va commencer, on a des 70 et plus, on a des groupes qui aussi prennent soin des personnes qui sont plus âgées. On veut vacciner les personnes qui ont certaines conditions médicales. Et puis aussi, on va vacciner les personnes qui sont essentielles, comme les personnes qui prennent soin des enfants, les early child educators, les enseignantes. On a toutes sortes de groupes. Et puis, on a aussi 60 et plus. Alors, tout le monde va avoir la chance d'être vacciné, mais on suit autant que possible les groupes qui ont été identifiés par NACI. Le groupe pour qu'on faire la vaccination pour les groupes qui sont plus à risque d'une manière ou d'une autre. Alors, ça va être tout sur le site Internet aussitôt que possible et puis ça va être traduit en français, je sais.
Docteur Morrison, la province, à partir de la semaine prochaine, aura donc des vaccins Pfizer, Moderna et AstraZeneca. Les deux premiers sont efficaces à 95% en gros. Le troisième, AstraZeneca, est seulement efficace pour le moment à 62%. Docteur Morrison, ma question c'est comment vous allez décider à qui on donne le Pfizer, à qui on donne le Moderna, à qui on donne le AstraZeneca? Et est-ce que les insulaires vont pouvoir, par exemple, refuser le AstraZeneca et demander le Pfizer et le Moderna?
Alors, c'est pourquoi on a le Pfizer, Moderna, sont les vaccins mRNA, c'est messenger RNA vaccin. AstraZeneca est un viral vector vaccin. Et alors, AstraZeneca est un bon vaccin et c'est très efficace pour prévenir d'être hospitalisé, être à l'hôpital ou d'avoir très malade avec COVID. Alors, c'est pour cette raison, c'est plutôt pour les personnes qui sont pas âgés, ils sont jeunes, en bonne santé et c'est pour cette raison qu'on va les offrir AstraZeneca pour les personnes qui sont un peu plus jeunes. Et s'il ne veut pas, il veut attendre pour le mRNA vaccine, il peut attendre et ils vont avoir le choix d'attendre, mais je pense que la plupart des gens vont, s'ils ont une chance d'être vaccinés, ils vont le prendre. Mais s'il ne veut pas, il peut attendre jusqu'à ils ont la chance d'avoir le mRNA vaccin.
Parfait. Merci beaucoup, Dr.
Okay.
Morrison.
Okay.
Bonne journée.
Okay. Bonne journée.
Well, thank you, everyone. Merci. Thank you, Dr. Morrison, and all Islanders stay safe and enjoy that lovely day out there.